We're going to talk about Asian eyelid enhancement, or so-called double eyelid procedure. Essentially what this involves is creating a crease on the upper eyelid, also known as a supratarsal crease. It's the fold that occurs up there, and oftentimes in some Asians that crease is absent. The eye could look a little narrower, there could be some fullness of the upper eyelid, and really what this is trying to do is to open up that eye and allow you to have a little bit more of an open expression that looks very appealing. Let me tell you what I don't do before I tell you what I do. First of all, I think the term westernization is very outdated. Back in the 1980s, there were a lot of procedures out there that made people look very unnatural. Way too much fat removed, way too much skin removed, creases made very high, and it simply looked artificial and unnatural. I refuse to do that kind of procedures. I think it just doesn't look good. Here's the difference. When I do procedures today, what I do is really make a very low crease, or maybe a slightly higher crease if someone desires that. And that crease is so important that it is small, relatively small, to make sure that it looks natural. I take very little to almost no fat out. And surprisingly, even though you may think you have a puffy eyelid, I've really found that either just the fixation of the crease itself is enough to elevate and open up that eye and create a very nice shape to the eye without necessarily having to remove a lot of fat. The technique I use is what's called a full incision technique. There are three principal methods to address the upper eyelid crease. There's an incision-based method, there's a limited incision method, and then there's also a suture-based method. Let me tell you my evolution. I really do not prefer the suture technique because I've seen a lot of failures with this over a period of a year to 2 years or 3 years. There can be ongoing loss of that fold. And also when you're trying to address the crease over time, let's say someone comes back and they're 45 or 50, they need to take some skin away. There is a risk at that point, if you take a little bit of skin away, that you could lose that fold that was created years before. The other technique, the partial incision, I did a lot of those in the past, but I found sometimes you could lose some of the fold over time. And in my opinion, that's distressing to me, so obviously to the patient as well. I've really adopted the full incision method that has the benefit of a really durable fixation. In other words, a result that's going to last you forever. And that's important to me. In terms of scarring, I really rarely, if ever, see something like that. It's a very smooth, elegant result. Let me walk you through the procedure, and let me walk you through some of the expectations and the recovery time thereafter. In terms of the procedure, it's an office-based procedure done in my surgery center, but with a very light degree of intravenous sedation. The reason I use a little sedation is I really want your experience to be absolutely comfortable. I have done both techniques with local anesthesia without sedation and with sedation, and I can tell you it's an amazing difference. With a little sedation, because I have a surgery center, it allows me to do that, which is pretty rare to find a physician that has a surgery center on site that can offer you that luxury, because I really want to emphasize two words: no pain. And I think that's a big deal to me. Part of the procedure, you will need to be cooperative, just to open your eyes and make sure that everything looks symmetrical. And that's going to be at the tail end, only for about 2 minutes. So the nice thing is we were able to structure that sleepy time, that time when you're sedated, for the first 20 to 25 minutes. In the last few minutes of the procedure, I wake you up, I make sure everything looks symmetrical, and you're pretty much done at that point. I just close, and you're done in about 5 minutes. Let me walk you through the recovery, because that's perhaps one of the most important things I can talk about. There is a recovery time that's involved. For the first week, it looks grossly too swollen, and I'm going to show you as you come in, and I'll walk you through photographically what you look like at a week, what you look like at 2 weeks, what you look like at a month, what you look like at 3 months, and there's an ongoing evolution even up to about a year after the procedure. It really is the first 1 to 2 weeks where it looks artificial and looks distorted, but thereafter it continues to improve. There are a few things that you can do to make this recovery a little bit shorter. Using some ice afterwards can help a lot for the first week. But also, if you do wear glasses, it's very important, because, well, not very important, but what it can do for you if you wear the glasses is at least it will frame the eye and make it a little less obvious that you have some swelling there. Also, if you are a female, you can wear a little mascara on the eyelids, and that can also help camouflage that. You can't do that the first week, but after the first week you can. It will look slightly too high even at a month, but the difference is most people already getting a lot better by that point. And again, I have to use photographs to really communicate this effectively with you. Even at 3 months, where it's just slightly on the high side by maybe a millimeter or so, it already looks pretty natural. It really takes a full year of evolution to really get that swelling all the way down to almost nothing. And again, I'll walk you through that photographically. There's one more topic that may be of interest to you, which is called an epicanthoplasty. An epicanthoplasty is a procedure that helps to change the shape of the inner or the outer eye where there is something called the epicanthus. It's the way that the skin folds downward. The technique I use for the epicanthoplasty is a technique that's very, very tiny and abbreviated that doesn't require an external skin incision outside here. The reason that's so important is, one, is your recovery time is relatively small, but what's even more important is it limits the chance of scarring. Now, I perform epicanthoplasties only in a minority of my double eyelid or Eyelid Blepharoplasties, only because I don't think most people need them. However, it's a nice adjunct that I can put on, or to even do as a separate procedure altogether if you should so desire. Now, you may have heard of something called the lateral canthoplasty, which is to open the eye on the outer portion. I rarely do that, and part of the real reason is that I don't think it really imparts much benefit. The procedure itself is very easy, but I don't think it will offer you much benefit. The procedures, when I do a lateral canthoplasty, really are for people that have scarring or webbing or some other kind of problem with the way, maybe a previous eyelid procedure that has caused that. Then I'll perform a lateral canthoplasty, and those people tend to get much more benefit from that than someone just coming in to have a standard epicanthoplasty or canthoplasty procedure. I hope that's a nice primer for you in terms of understanding what is involved with an Eyelid Blepharoplasty or double eyelid procedure, as well as an epicanthoplasty. I do encourage you, if you like, you can bring in some photographs of models that you like in terms of the shapes of the eyelids, and that will help us establish a good dialogue between us.